Hi everyone, welcome again to another episode of Smart and Healthy Lifestyle, where we get to discuss issues related to health and nutrition. And for today's episode, I want us to focus on tuberculosis, being a potentially infectious disease, very serious disease that can cause death if not prevented or if strict measures are not taken on time. So my main focus today will be how to use diet in treatment of active tuberculosis. I'm talking about active because there's a time where somebody can have the bacteria that causes tuberculosis, but it's not infectious. So they are in the latent phase. So mainly today I want to focus on diet and those who are having active tuberculosis. So before I continue, if you're new to this channel, kindly subscribe to the channel. Make sure you give this video a like and kindly share, because tuberculosis being a very serious, highly infectious disease, everyone needs to have knowledge about it. So to brush off, I'll be talking about what tuberculosis is, the symptoms, which sites are mainly affected, and the implications or the effect, especially on the nutritional status of a person, and then the treatment using the diet. So kindly don't go far. You're welcome to stay with me until the end of the episode. So tuberculosis is a bacterial disease that is caused by Mycobacterium tuberculosis. So it is caused by a bacteria, and it can be spread from one person to another through airborne particles when an infected person coughs, sneezes, sings, or even laughs. So once you are exposed to the bacterial particles, it does not mean that you're going to be infected right away. It takes some time. So and it depends on several factors. For example, how long have you been exposed to the infected person? What is the environment that you're residing in? For example, if you're coming from an overcrowded place like a slum, you are at high risk of being infected by the bacteria. And then another thing, it will depend on your immune system, especially for those who have their immune system is compromised, like for example, for the cancer patients, for the diabetes and other complicated disorders, they are also at high risk of getting tuberculosis. And then another thing is how nourished is your body. If you are undernourished, you are also at a higher risk of being infected by tuberculosis. So eating well and boosting your immune system is a very important way of preventing infections through the tuberculosis. So tuberculosis will affect different sites of the body and will be diagnosed according to the site that has been affected. Mostly tuberculosis affect the lungs. That is called pulmonary tuberculosis, and it accounts for 85% of all cases that are being reported. Other places that can be affected are the kidney, the spine, or the kidney, the spine, or the brain. Yeah, tuberculosis can also affect the brain. So symptoms will depend on the site that is being affected. For the pulmonary tuberculosis that is affecting the lungs, you'll find that that person is having chest pain, especially when you're breathing in or you're coughing. Then there are fevers, persistent fevers. There are sweats at night. You're sweating a lot at night. And then we have unintentional weight loss, depending, maybe for the last 1 month, if you check your weight well, you'll find that you have lost a lot of weight, more than 5%. And then we also have fatigue. You're highly fatigued, you're exhausted so much. So those are some of the symptoms of tuberculosis. So it's wise that you visit a health center and they examine you from your medical records, from your history and all that, from all other examinations, to find out whether it's tuberculosis or not. And another thing to note is that in children, it's very hard to diagnose tuberculosis just like that, because the symptoms will be confused with other illnesses, like for example malaria or other respiratory infections. So if you have a kid who has been coughing for some time, has been having diarrhea for more than 1 month, and then also the sweats and the fevers, it's wise you visit a health center so that they diagnose it. And this kid is not thriving. Their weight is stagnant or they are just losing weight. It's wise that you visit a health center, they examine your kid and find out what is eating your kid. So those are the symptoms. For other areas that has been affected, like we have the brain, the spine, and then we have also the kidney. The kidneys. The person might be suffering from frequent back pain, and then it's also dark urine. There is blood in the urine. So again, it's wise you visit a health center. Tuberculosis. For a person that is suffering from tuberculosis, how does it affect their body? One thing to note is that tuberculosis, when it is in its active form, it may lead to poor appetite. There's highly reduced appetite. This person is not eating well, is not getting all the nutrients that are required in the body, is not getting all the micronutrients, especially the vitamin A, vitamin D, E, K, C, some of the minerals like zinc and iron. So at the end of the day, there's reduced immune system. There's also, it can lead to anemia. So this is one of the side effects of tuberculosis on a person. Another thing is that people tend to lose weight mostly. And for the severely wasted patient, it's very hard for them to recover as fast as possible. So that's another. In children, there's growth failure. These people are not, the kids are not increasing in weight or the height. They're stagnated. Then there's another thing that, as we saw earlier, when it affects the lungs, it may lead to the lesions in the lungs. So it also require high amount of nutrients for this person to start recovering from the problems that are caused. Another thing is that the drugs that are being used to treat tuberculosis themselves, they are affecting this person. They may affect this person. So mainly they interact with first of all with the food that the person is taking. So it may lead also to anemia. It may lead to other complications like hepatitis, numbness of the feet and the hands, what we term as peripheral neuropathy. So most of the people, the medication that most of the people report of side effects like the rashes, and they're feeling pain in their feet or the legs. It can also lead to loss of appetite. That's also another complication. So that's why we are saying that tuberculosis is a very serious disease that needs maximum attention, timely intervention. About the treatment of the person, apart from medications that you're going to be given, which initially you're given 4 drugs to consume for a period of like 2 months, and then continuous phase of treatment, the drug may reduce, or actually after examining your adherence, monitoring how you're taking the drug. So change of drug will depend also on the person. So when you come to me as a nutritionist, what is my role in making sure that I increase your recovery as early as possible? One thing I'm going to do is assessing you, taking your weight, your height, determining your nutritional status. How is it? Are you on the lower side? Are you severely undernourished? And all that. That is my role in your treatment. And another thing, I'm going to put you on nutritional supplements. These ones will depend on your nutritional status. How severely are you affected? So I might give you therapeutic feeds. I will also supplement you with micronutrients like vitamin A. And then my role is also to counsel you on the proper diet that you're going to take. And one thing you should be noting is that there's no special diet. Actually, I have to disappoint you. There's no special diet that will help you in recovering from tuberculosis. But one, you should consider eating a healthy, balanced diet. And when I'm talking about a balanced diet, I'm referring to all the food groups, from the carbohydrates, the protein, the fats, reduce sugar intake, and the water. Water is also vital, and the other micronutrients, especially foods that are rich in vitamin A, foods that are rich in vitamin D, foods that are rich in calcium, because we've seen that tuberculosis is affecting how these nutrients are being absorbed or how the body is taking up the nutrients. So mostly it affects the stores of the calcium, the vitamin D, the vitamin A, the vitamin E, which are involved in the strengthening of your immune system, the lean mass, and the bones. So I'm going to encourage you to eat a balanced diet, because from a balanced diet you're going to get variety of all the nutrients, so from all the food groups plus the proteins. I encourage you to increase your intake of proteins to increase your muscle mass, because mostly these patients come when they are severely wasted. So you require increased energy intake, you require increased protein intake, you require intake of the micronutrients, and you're going to get all this from your a balanced diet. Then another thing I note from patients who come and see me is that they have a reduced appetite. Unaweza kosana na mgonjwa uko nyumbani kama haumwelewi. So one thing we encourage is that instead of eating the 3 main meals, let this person eat 6 feeds which are highly nourished. If in case that it is porridge, you have to enrich some of the foods. You can use sugar, but at a reduced content, not high amount of sugars in your food. You can enrich. We have eggs that are they are rich in protein. We have peanut butter there at home. We have also margarine, but at a reduced rate. So try to enrich most of their food. Try to cook these foods well so that they make you have appetite. If the environment that you're feeding in is not conducive, you are allowed to go outside, get fresh air. Open all your windows, let fresh air come. If it's possible, cook your food using spices that are tolerable. Some of the medications that you're taking may lead to diarrhea, constipation, or abdominal cramping. So some of these patients may not need spices, like high spices, like now using Royco garlic. Some of them are affected. So cook your food well that is palatable. 6 feeds are enough per day. Drink your water well to enable you remove the toxins from the body, and for joint pain and all that. That's one important of it. Eat variety of fruits, especially the orange flesh that have vitamin A. Eat vegetables. You are encouraged to eat vegetables. Eat also iron-rich foods, because we've seen one of the complications of tuberculosis. It may lead to low hemoglobin levels in the body, and therefore most of the patients may become anemic. Report any side effects of your drugs to your healthcare. If you find you have a rash, you find that your urine is becoming darker and darker, kindly do not just sit, report. You might be having a GI irritation or the bleeding of the inside of the GI tract. It's also some of the complication of the drugs. And then another role, if you come to me, I'm going to design a plan that to find how your drugs are going to interact with your food. There are some drugs that you're encouraged to take 30 minutes before eating or 2 hours after eating, especially isoniazid and rifampin, because they affect how your other nutrients are going to be absorbed, especially vitamin B6 or vitamin B12, which are also needed in your neurons, the nerve functioning. That's also needed in some of the formation of the hemoglobin. So that is, I'm going to put you on a drug and food regimen so that you recover the mycobacterium is cleared as fast as possible. A balanced diet, cooking your meals well, enriching your meals with things like peanut butter, milk, eggs, and all that. Rehydration, using either we can use water, soups is allowed, porridge is allowed, and consuming adequate amount of proteins, especially from milk, like 500 to 750 mLs of milk per day. If you're an alcoholic, kindly you're advised to stop alcohol, because it will affect how your drugs are being, your treatment, actually how effective your drugs are going to work. It's going to affect that. And also alcohol may lead to deficiency of other nutrients like vitamin B6. So you are advised to stop your alcohol. If you are a smoker, kindly stop smoking. Then also observe hygiene and sanitation. Cook your food well at the right temperatures, not just undercook. Things like fish. Being exposed to this person does not mean that you're going to be infected by the tuberculosis itself and also suffer. No. If your immune system is well, you're not going to suffer. So just try to encourage them, eat well, help them even in preparation of meals, because they are fatigued, their immune system is down and all that. Kindly do not neglect them. I hope you've learned something. And as I said, If you're not subscribed to this channel, kindly subscribe, like the video, and share widely. And do not forget to subscribe, because there are so many episodes that I usually come up with every now and then, and I don't want you to miss out. I've been your favorite nutritionist, Jemimah Egesa. Until another time,